My name is James Clarke, and the title of my poster is Exploring the Effectiveness of a Public Health Strategy to Control Chlamydia. So, chlamydia is the most diagnosed sexually transmitted infection, and if left untreated, it can cause a number of different and quite extreme complications in men and women. So, chlamydia is a significant public health burden, and I'm hoping to model the short-term impact of changes in strategy for controlling chlamydia. So due to the nature of the way chlamydia is spread, by contacting infected persons' partners and randomly screening people, we can hopefully control the infection. So I constructed a model based on pair approximation equations. So the underlying contact structure of chlamydia transmission is very strongly defined. Has very strongly defined transmission events. So by looking at mean field equations, we can hopefully capture this behaviour. And we see that if we look at partner positivity and individual positivity, so individual positivity is a chance of someone who is screened being positive for chlamydia. This follows the prevalence profile very closely. Well, if we look at partner positivity, it stays pretty much constant, as we can see in these graphs here. So individual positivity decreases with prevalence, whereas partner positivity remains largely constant. And also comparing these equations to mean field equations, we see that just looking at short-term dynamic changes, mean field equations do not capture quite the same behaviour as pair equations. So here we see over 1 year what happens with prevalence in mean field equations, and here for mean field equations, and it's quite a big difference. So when it comes to assessing costs of interventions, we see that the model choice is very important, and dynamic behaviour should be considered as well as steady state behaviour.